Today, I'm going to be sharing two different types of treatment activities that we can use to target receptive language goal with a patient with global aphasia. Again, this patient was diagnosed with an ischemic stroke that led to global aphasia, and some difficulties among individuals with global aphasia include difficulty with fluency, so speech production and expressive language, with comprehension, and with repetition. The long-term goal that was established for this patient states patient will increase auditory comprehension of simple directions and conversations about his immediate environment given moderate cues with 80% accuracy. And the short-term goal stated under the area of receptive language for this long-term goal states patient will answer yes or no questions regarding immediate environment given moderate cues with 70% accuracy. So the treatment activities are focused on targeting this specific goal. The first activity that we can use is answering yes or no questions at the sentence level. Now, for this activity, the clinician asks the patient a question, and then the patient can answer with a yes or no, either verbally, using a gesture such as nodding their head yes or shaking their head for no, or by pointing to the right answer, for example, to a picture of a smiling face for yes, or a picture of a frowning face for no if the patient has reading difficulties. Now, some examples of questions in different topics include those for general knowledge. For example, do some people dance to music? And we would wait for the patient to answer yes or no, again, using either verbal output, gestures, or by pointing. We can ask personal questions like, do you have black hair or are you married? And of course, we would know the answers to these questions, so we would know if the responses are correct or not. Orientation questions include, are we in the hospital or are we in the month of May? Factual questions can include, do plants wear glasses or do storms damage homes? And we can also ask semantic discrimination questions like, is a hammer a tool? Does it fall into that category? Or is a rock an animal? The second activity we could use to target this particular short-term goal includes sentence verification. And for this activity, the clinician asks the patient to judge a specific sentence and then answer with a yes or a no whether that sentence is true or false. Now, sentences can be presented on either the basis of a patient's general knowledge or alongside pictures. So, for example, those sentences on the basis of general knowledge can include, it is colder in the winter than in the summer. And we would wait to see if the patient responds with a yes or a no to verify that sentence. Or the sun sets in the evening. And again, we can wait for that response, whether verbal, with gestures, or with pointing. We can also present sentences to verify alongside a picture. So we can show a picture of a shoe, and then we can state, this is a shoe. And we would wait to see if the patient verifies that sentence. Or we can show a picture of a woman washing dishes, and we can state the woman is washing dishes. And again, we would wait to see the patient verify either a yes or a no.